Frankie Rodriguez, and it's no fibula that I did my project on the tibia to get a leg up on my grade. What I did is the integumentary, the muscular, the skeletal, and the nervous system, all to show you how it works towards having a knee replacement surgery done. Let's start off with the integumentary system. It has the epidermis, which is 5 layers thick. It's where your sweat and oil pores are located, and it's also what you see when you look at your skin. The dermis, which is the middle layer, is where your pores, your nerves, and your hair follicles and lymph vessels are all located. It contains the collagen and elastin. It also provides the support that you need for your skin. The subcutaneous tissue right here is your fatty tissue. It's what keeps us all nice and warm for the winter. It also acts as a shock absorber. I've got plenty of shock absorber. So let's move on from our little leg. This is the muscular system. And forgive me if I say any of these words wrong. They're kind of hard. In the upper leg, you have the muscles. In the lower leg, you have the muscles. And then you also have tendons and ligaments. Let's start with the upper leg. In your back of the thigh, you have the hamstrings. In the front, you have the quadriceps. And in the middle of your legs, you have the adductors. Part of the hamstrings is the semimembranous muscle, the semitendinosus muscle, and the biceps femoris. The quadriceps, which means 4, is the vastus lateralis, the vastus medialis, the vastus intermedius, and the rectus femoris. It helps you to straighten your leg from a bent position. The adductor is what helps you close your legs. There's five of those. There's the adductor longus, the adductor brevis, the adductor magnus, the obturator externus, and the gracilis. On the lower leg, down here, you have the gastrocnemius, which is the main muscle of the calf, right here. This helps you with pointing your toes downwards. All those ballet dancers, they just love this muscle. The soleus, right here, is located behind the gastrocnemius, and it helps with the plantar flexion as well. The tibialis muscles, found in the front and the side of the lower leg, helps with moving your toes upward, the dorsiflexion. The back muscles allow for the plantar flexion and helps with your arch as well. There's also tendons located. The main tendons that we're going to be talking about is the patellar tendon that attaches to the tibia, to the patella. The bands of connective tissues. The tendons are bands of connective tissues that are found at the end of muscles, and they attach muscles to the bone. The largest tendon in the knee is the patellar tendon. The quadriceps tendon attaches the quadriceps muscle to the patella, and the Achilles, which is down here, attaches the muscles from the calf to the bone of the ankle. The knee ligaments, which is very vital in a knee replacement surgery. The anterior cruciate ligament prevents the tibia from moving past its limits forward. The posterior cruciate ligament keeps the tibia from going too far backwards. And oftentimes in a knee replacement surgery, this gets cut. Medial collateral ligament stabilizes the inner knee from going too far inwards, and the lateral collateral ligament keeps it going too far outwards. Other structures on this would be the bursae, which we have 14 of them in each knee. They're small sacs filled with fluid, and they reduce friction and inflammation. The meniscus, which I'll show you in another poster, we have 2 of them. We have medial and we have lateral, but they're discs of cartilage, and they're shock absorbers. They help to evenly distribute the weight in our body and provide balance and stability. Moving on, we're going to go to the nervous system. In the nervous system, we learned that there was 4 plexuses in the whole body. Well, in our poster here, we have the lumbar plexus and the sacral plexus. The lumbar plexus is the largest nerve in the femoral nerve, which is up here. Damage to this could cause you not to be able to extend your hip, or extend your leg, or flex your hip. The obturator nerve is the medial thigh. It's right here. It's up in the medial thigh, and it's also located in the skin as well. Damage to this can lead to an inability to adduct your thigh or spread your legs. Sacral plexus, which is the one I always have the hardest time with, is going to be right in here. It is a major nerve in the body, the sciatic nerve. If damaged, you'll be unable to extend your hip or flex your knee. This particular nerve, it actually divides into two different nerves. The confibular nerve, which is located in the lateral aspect of the leg, and if it is damaged, it could cause a drop foot. The tibial nerve is located right here on the posterior aspect of the leg, and it's damaged, it can cause a shuffling gait. Moving on to the skeletal system, we have the femur, the tibia, the fibula, and the patella, which is the main components in my whole project. The femur is the largest and the longest of all the bones. It has the ball and socket joint to go to the hip, and it also connects to the knee. It's called the thigh bone. The tibia is called the shin bone. It connects up to the knee joint. And it's the second largest in the body. The fibula is the weakest, and it's right behind the tibia. It is called the calf bone. The fibula is also connected by ligaments. The patella is your kneecap. It is located in the middle of your knee, and it slides on the grooves of your femur. And it will help you also extend the knee and protect your joints. Now, what will happen as you get older, as I was telling you about meniscus, cartilage, you'll lose all that. And what happens is you have bone on bone in your body. So after many procedures that people can do, they will opt into having a knee replacement surgery. And when you have a knee replacement surgery, what they do is they go in and they'll shave off the parts that are really bad, and they'll not actually take apart your patella, but they'll move your patella to the side. And we're going to go ahead and discuss that in another poster. So what we have here is an osteoarthritis leg. The osteoarthritis is the degenerative arthritis, and it wears and tears down on your knees, causing the cartilage to be worn and rough and go away. It grinds away at it. What happens when homeostasis is not kept in your knee is the tissues and the ligaments don't actually rebuild or repair between the tibia and the femur, and you'll have these problems. This could cause pain, swelling, instability, even catching. Hence the reason why people have knee replacements. Surgery is often performed for people with osteoarthritis, rheumatoid arthritis, psoriatic arthritis, and even trauma. Risk factors include deep vein thrombosis, which happens in 15% of your patients, nerve injuries, 1 to 2% of your patients, persistent pain, 8 to 23% of your patients, and even prosthesis failure, which is less than 2% in 5 years. Surgery is always a possibility. So when you have surgery, like I said, what they do is they go in and they shave off the bad parts of the bone that was there. They remove the rough and torn out cartilage from the bone. They'll expose the front of the knee, the skin part, the muscles, the nerves, and they'll expose it all the way down, detaching the quadriceps from the patella. The patella gets moved to the side. I couldn't actually picture that, but and that's when they actually get down and cut away everything on this bone. The cartilage and anterior cruciate ligament gets removed. Sometimes, as I was telling you earlier, the posterior cruciate ligament might be removed as well. The tibia and fibular collateral ligaments are preserved, and those are the ones that are on the side. Metal components are then hammered into your bone and fixed with cement. The tibia component is flat, where the femur component is actually curved, shaped to your bone. The flattened is raised, and it's made of a polyethylene, and this part right here it's like a shock absorber. It keeps from the metal and the metal hitting. There's also a kneecap component called the patellar plate that gets put in underneath the patellar here. Is actually a polyethylene button cemented into the posterior of the patella. This is what you would look like after surgery. Of course, more together. My conclusion, drink a lot of milk, y'all. Milk really does do a body good. And remember your vitamin D and take good care of your bodies. Because if not, you might end up for all of this because of worn out cartilage. Thank you.